At the outset, I would like to thank the organizers for giving me this opportunity to present on team-based learning. It's a very big learning forum for me. I've quite learned from all the experts who have deliberated so far, and I would like to present on team-based learning. We know that team-based learning is an innovative teaching and learning strategy that has gained popularity in various educational settings, including nursing education. It is an active learning approach designed to promote student engagement, critical thinking, and collaborative skills. In the context of nursing, TBL is particularly valuable for preparing students for the complex and interdisciplinary nature of healthcare. I just would like to give some of the key points that are to be remembered. Team-based learning is a pedagogical strategy that engages student knowledge through individual testing and group collaboration. Following individual answers, students join teams and work through problems, appealing when they are incorrect. So what is the concept? What is the concept of team-based learning? Team-based learning is a structured form of small group learning that emphasizes student preparation out of class and application of knowledge in class. Students are organized strategically to diverse teams of 5 to 7 students that work together throughout the class. And there needs to be a curriculum design for this, identifying the specific learning objectives and topics that align with the pediatric nursing. Especially, we can talk about growth and development of children. We can talk about pediatric pharmacology. We can talk about assessment of children and assessment of sick children as well, family-centered care, and so on. So, and also common problems that can be related to the country need. For example, in India, if we think of the main cause for under 5 mortality, we can think of acute respiratory infections, and then the diarrheal disorders. Then we can think of communicable diseases, and so on. So depending on the area specific needs, we can actually select the topics. So there should be a curriculum design developed to deliberate on this, and then we go ahead forming a team. So team formation is a crucial step. Organizing students into the permanent teams are at the beginning of the course, and these teams should remain consistent throughout the term to foster teamwork and collaboration. Actually, it's a kind of pleasant and harmonious learning process, and so therefore the team will remain throughout intact. So all of them will know each other. In the initial run, there will be an ice breaking, and then they get to know each other, and they'll be functioning in collaboration throughout the entire process. And so what is, after selecting the course design, the curriculum design, and then after formulating the team, what is the next step to move forward will be readiness assurance process. Once the team is selected, then they have to be well prepared on the topic. So they must be told what are some of the topics that they have to brainstorm and come prepared. So readiness assurance process, where creating readiness tests, there will be RATs, we call them as RATs, that cover the pre-assigned readings and key concepts related to the pediatric nursing, the relevant topics that have been handed over to them. So the RATs or the RATs should include multiple choice questions to assess the individual and team readiness. We will assess the individual readiness and also we will be assessing the team readiness. We will give a multiple choice kind of a question. We can, how many questions to come forth with, maybe 10 questions, 20 questions, depending on the topic. And individually performance evaluation will be done, and the same questions will be given to the team, and they can sit together, they can brainstorm, they can talk out, and they can discuss. But we must make sure that the entire team participates. There should be good kind of cooperation. Not in a team, one is sitting passively and the others are active and things like that. So who does that kind of facilitation? The person who is taking care of the entire process, the team leaders or the facilitators, they will make sure that the entire team participates. So after the readiness awareness assurance process, the next step will be to do the application of activities. So designing application activities that are specific to the pediatric nursing scenarios. Actually, we can prepare scenarios like pediatric CPR or pediatric management of diarrhea in children, or management of acute respiratory infections children. So the relevant topics are selected, scenarios are prepared ahead of time, and these could involve case studies. This could also involve simulations or role plays, exercises. It can be in any form for that matter. It can be a critical thinking or problem-based learning, whichever. It will be better if we can incorporate many types of learning modalities, so that it will be more interesting instead of making it so kind of monotonous, which will actually tire out or burn out the participants. And after application activities, assessment and feedback is obtained. So assessing both the individual performance as well as the team performance. The team performance is assessed by giving out the evaluation forms, and the peer members evaluate each other. What is their contribution? How much they want to grade their colleagues based on the contribution that they've made. Different criteria are there, and so the peers will evaluate them. And individually also, the client is made responsible to make an assessment of her own self or his own self. Faculty training is the important component in this team-based learning, where the faculty must be trained well enough. If they've not undergone the training, then it will be very difficult for them to move on with the process. Unless they are expert on the particular topic, it will be very difficult for them to facilitate the entire process, and therefore ensuring that the faculty members leading the TBL sessions receive prompt training in TBL, the methodology, how should they go about, as well as about the pediatric content itself, pediatric topics itself. So ahead of time, they should be given the topic so that they'll be well prepared, and also they should be trained how to go about with the team-based building process. So faculty should be able to facilitate the discussions effectively, promote a supportive learning environment, and providing guidance when the students encounter challenges. It is a very pleasant process. At the same time, the facilitator should give positive kind of critiquing should be there, but it should be not in a way to knock off the students' contribution. They must make it more promotive and more interactive, giving positive strokes so that the entire team will participate, and that will be more kind of welcoming for the participants, and they will look forward to the team-based building and develop an interest towards team-based building. Physical space and technology is also very, very important. The facilitator should make sure that the environment is pleasant, the physical environment, the lighting, the soundproof, all that should be well taken care ahead of time. And also technology, all the tools that are required. Maybe they need computers, or they may need some charts, or they may need some materials, whatever printed out materials which they would have put forth. The request definitely would have been put forth by the participants. So all that should be prepared, and it should be brought forth to the area, to the conference room, so that they will have enough technology in hand, and they'll be able to come out with their thoughts, ideas, which will facilitate more learning. So adaptation to the pediatric population, emphasizing the unique aspects of pediatric care, such as developmental needs, developmental stage, family-centered care. That's the most important thing which we need to talk about. And pediatric pharmacology. So like that, whatever topics we have selected should be given to them, and they will be able to complement each other. They'll be able to learn because they are already coming prepared to the sessions. And during the team-based building, we must make sure continuous improvement happens, collecting key feedback both from the candidates individually and also as a collective kind of feedback from the participants, where they do the peer evaluation. At the end, even the faculty will be evaluated. They have to be evaluated, so that they will also know what are their pitfalls or what are their pluses, so that they'll be able to make it more pleasant for the forthcoming sessions. So TBL process, the pre-class preparation, students review assignment materials before the class, and readiness assurance test, an individual and team-based assessment to check understanding, application of activities, teamwork and problem-solving exercises, immediate feedback and discussions and clarification of concepts. All should happen in a very sequential manner, and the role of the facilitator or the instructor is very, very important. In TBL, They actually facilitate the process, they provide guidance, they support the team in their learning journey, and they serve as content experts and help clarify misunderstanding and during which can happen during the session. Assessment in TBL typically includes individual and team-based components, encouraging accountability and promoting collaboration, and it assesses not only knowledge but also the application and the teamwork skills. There can be challenges faced during the process because not all participants may show a kind of involvement, and some of them may just back off, and some of them may be taking up very actively, where every time they will be raising up concerns, and sometimes it can go out of control. So that's why the facilitators, they have to make sure that they undergo a training as to they have to learn how to involve the inactive participants and how to have a kind of control over the very active participants who sometimes can be acting over smart. And so all this training is given for the faculty during the process, and therefore they'll be able to make it very successful. So team-based learning, it's a very kind of trending mode of learning, and in a hospital we try to incorporate this kind of learning very often for our student education, for nursing practice, for the staff nurses. We get them involved into this, and every nursing faculty and every nurse manager should incorporate this mode, which is a kind of trend, and it will really make it very, very useful for the learners. And so I thought this is one which has been introduced, should I say, maybe a year ago, and so it's something new in our own area, in our own setup in our hospital, and so I thought I will share the feedback of what is happening here. Once again, I would like to thank the entire team for giving me this opportunity, and it's very nice working with the team, such a supportive team, and God bless the entire team. And my prayers are there for all of you, and kindly pray for us also. God bless. Thank you.